Hi everyone. Welcome to the Basic CPR Basic Training. I'm Kim Hee-ju, and I'll be guiding you through the session. So, how familiar are you with CPR? In this session, we'll go over the essential life-saving skills everyone should know. But first, let's start with a video on why CPR matters.
It's a typical weekday morning. Min-woo, in his 40s, feels pressure in his chest, but brushes off and goes to work.
I'm fine, really. It's just a little tightness that comes with age. Don't worry too much. I'll start exercising next week, I promise. Love you. See you later. Ugh, not again. Ugh.
He feels sharp chest pain and collapses.
Somebody's down.
People don't know what due to. Then, a man steps forward.
Maybe we should take him to the hospital.
Wait.
It's
Hey,
Sung
can
Joon,
you hear
who
me?
works at a company nearby.
I think he's in cardiac arrest. We need CPR right away.
But what if it goes wrong?
I've had CPR training at work. Ma'am, call 119. Sir, get an AED.
AED? Got it.
Just as he learned in training, Sung Joon called for help and started CPR right away.
1, 2, 3, 4, 5, 6, 7, 8.
Hello, 119? I'm calling from Ilwon-dong 81 Gangnam-gu. A man just collapsed.
1, 2, 3, 4, 5,
He
6,
appears
7,
to be in
8.
cardiac arrest. We need help right away.
13,
Here's an
14,
AED.
15. Can you do CPR?
No, I can't.
I can do it.
Can you take over compressions?
Okay.
Place the pads to the patient's chest.
Stay clear.
Push the flashing shock button. Shock delivered. Begin CPR.
About 3-4 minutes after the cardiac arrest, the 119 team arrived.
We're from Gangnam Fire Station. We've got it from here. Checking the patient. Sir, can you hear me? No response. Checking pulse. No pulse. Starting CPR. Apply pads. 1, 2, 3, 4, 5, 6, 7. Analyzing rhythm. Stand clear. Shock needed. Charging. Stand clear. Shock on 3. 1, 2, 3. Shock. Start CPR immediately. Who was performing CPR before we got here? Could you tell me what happened?
That was me. He clutched his chest and collapsed.
Clutched his chest and collapsed. Got it. How long ago?
It's been about 3-4 minutes now.
About 3 to 4 minutes. All right, we'll take it from here. Checking rhythm again. Stand clear. Rhythm is back. Check pulse. Pulse is back. We have a pulse. Checking breathing. Chest is rising. Breathing is back. Let's get him to transport.
Thanks to swift action by the 119 team, he regained consciousness and was quickly taken to the hospital. Just days later, Min-woo was back to normal. So don't hold back. Your CPR could save a life.
절실한 생명의 끈이 될 수도 있습니다.
Sudden cardiac arrest means the heart suddenly stops and the body shuts down.
신체 기능이 정상적으로 작동하지 않는 상태입니다.
It happens to about 30,000 people each year, and almost 28,000 don't make it, according to the Korea Disease Control and Prevention Agency. That's nearly 8 times the 3,300 lives lost in traffic accidents. It's a reminder that this could happen to anyone. Cardiac arrest isn't something that happens somewhere else. Nearly 40% happen at home.
가장 많이 발생하는 장소로 나타났습니다. 즉 여러분들이 주로 생활하는 여러 공간에서 발생한다고 볼 수 있죠.
Imagine your loved one collapsing right in front of you. What would you do? In that critical moment, the only lifeline is CPR. The moment the heart stops, blood flow stops as well. By performing CPR, we can keep pushing oxygen to the brain and the body. That's why quick action is critical. For the best chance of survival, CPR must begin within 4 to 5 minutes after the heart stops. That's what we call the golden time.
Survival rates are 2 to 3 times higher when CPR is performed immediately than when it's not performed at all. With an AED, those odds can climb up to 4 to 5 times. However, without any action for over 5 minutes, the brain may start to suffer damage from the lack of oxygen.
That's why survival often depends on the first person to act. CPR can't wait for paramedics or doctors. It starts with whoever's right there, and that person could be you. According to a recent survey by the KDCA, the rate of laypersons performing CPR on cardiac arrest patients rose from just 1.9% in 2008 to 24.7% in 2019, a remarkable 13-fold increase over 11 years. Consequently, the survival rate of cardiac arrest patients in Korea also increased significantly from 2.3% in 2006 to 8.7% in 2019, nearly a 4-fold rise over 13 years. Among approximately 30,000 cases annually, when a witness at the scene performs CPR, the survival rate reaches 15%, nearly 2.4 times higher than the 6.2% rate when CPR is not provided. We all know CPR is important, but hesitate to act in real situations. The reason is probably the fear that if I step forward and fail to save them, what then? But you don't need to worry. The law protects anyone who tries to help, even if something goes wrong during CPR. What matters most is saving a life. Even imperfect CPR is better than doing nothing. If you see someone collapse, don't hesitate. Just start with chest compressions. Here's a story of real-life heroes who work together to save a life. Recently, at an apartment complex, a security guard in his 70s suddenly collapsed. A neighbor acted immediately, performing CPR, while apartment staff ran for an AED. Even amid the morning rush, neighbors came together to save his life. Fortunately, he regained consciousness and said it felt like being given a new life, offering heartfelt thanks to his neighbors and the 119 team. What's notable in this case is that the lay rescuer successfully performed CPR, assisted by the instructions from a 119 dispatcher over the phone.
So, even if you're unsure about CPR, don't hesitate. Call 119 and you'll get real-time guidance. And many organizations provide CPR training so you can learn hands-on.
As seen in this case, a life can be saved by the quick actions of those nearby. We hope this story inspires everyone to keep learning and practicing CPR so that when the moment comes, we'll be ready to act. All right, let's get started with CPR, the 5-minute miracle. Now, picture someone suddenly collapsing right in front of you. What's your first move?
가장 먼저 해야 할 일은 무엇일까요?
The very first step is to check if the person responds. If you think it is cardiac arrest, shout for help to call 119 and get an AED. Then, make sure to check if the patient is breathing normally. If you follow the instructor's instructions carefully from now on, you'll be able to perform CPR calmly and without panic even in an emergency. Are you ready?
If you see a person collapse, the first step is to check if CPR is needed. Check your surroundings for safety, then approach the patient. Then approach the patient. Gently tap the person's shoulders and check for a response.
Can you hear me?
If there's no response, call for help immediately as it may be cardiac arrest. When people are around, point to someone and be specific.
You in the black t-shirt with the backpack, call 119 immediately. You in the gray t-shirt, get an AED.
Once you've asked for help, the next step is to check for breathing. In cardiac arrest, the body becomes limp and show no normal breathing or movement. Irregular gasps or brief convulsions after collapse can also mean cardiac arrest. If you judge that the person is in cardiac arrest, begin chest compressions immediately. Let's try it together. We'll practice 2 times.
Hey, are you okay? Can you hear me? You in the black t-shirt with the backpack, call 119 immediately. You in the gray t-shirt, get an AED.
Let's try it together.
Hey, are you okay? Can you hear me? You in the black t-shirt with the backpack, call 119 immediately. You in the gray t-shirt, get an AED.
Let's try it together.
Hey, are you okay? Can you hear me? You in the black t-shirt with the backpack, call 119 immediately. You in the gray t-shirt, get an AED.
Let's try it together.
Hey, are you okay? Can you hear me? You in the black t-shirt with the backpack, call 119 immediately. You in the gray t-shirt, get an AED.
Let's try it together.
Hey, hey! Are you okay? Can you hear me? You in the black t-shirt with the backpack, call 119 immediately. You in the gray t-shirt, get an AED.
Let's try it together.
Hey, hey! Are you okay? Can you hear me? You in the black t-shirt with the backpack, call 119 immediately. You in the gray t-shirt, get an AED.
Great job, everyone. One thing to keep in mind, when there are many people around, always point to someone directly. And don't forget to ask for both a 119 call and an AED. Now, let's consider a situation where there's no one around to help. Imagine you're alone with a person who may have suffered cardiac arrest. This can be scary, but don't panic. Call 119 right away and put your phone on speaker so the dispatcher can guide you through CPR until first responders arrive. Now, let's walk through exactly what to do in this situation.
When you find someone collapsed and you're alone, check for a response first by gently tapping the person's shoulders.
Dad, are you okay? Can you hear me?
If there is no response, call 119 immediately since the person may be in cardiac arrest. Dial 119 on your mobile phone and follow the instructions of the emergency medical dispatcher.
119. What's your emergency?
My father collapsed. Please help.
What's the address?
It's Daehan Apartment, 103-104 in Hangok-dong.
Is he conscious?
No, he isn't responding.
Is he breathing normally?
I don't think so.
Sounds like he's in cardiac arrest. Don't worry, an ambulance is on the way. Switch to speakerphone and start CPR, following instructions until help arrives.
Use the speakerphone to perform CPR until emergency responders arrive on the scene.
Place the phone on the ground next to you and do not hang up. I'll stay with you until the ambulance gets there. First, lay the patient on a flat surface.
Make sure the patient is lying straight on a hard, flat surface, no pillows or cushions.
Please expose the patient's chest.
Clear the chest by removing any clothing.
Then, kneel down at the patient's side. Place the heel of one hand on the lower half of the breastbone. Set the other hand on top. Lock your fingers together.
And straighten your elbows. From a kneeling position, press straight down on the chest. We just watched how CPR is be done with the instructions from a 119 dispatcher. We'll cover CPR in more detail in the next section. Let's try it together. Just one round of practice.
Dad, are you okay? Can you hear me?
"119, what's your emergency?
My father collapsed. Please help.
What's the address?
State your address.
Is he conscious?
No, he isn't responding.
Is he breathing normally?
I don't think so.
Sounds like he's in cardiac arrest. Don't worry, an ambulance is on the way. Switch to speakerphone and start CPR, following instructions until help arrives. Place the phone on the ground next to you and do not hang up. I'll stay with you until the ambulance gets there. First, lay the patient on a flat surface. Clear the chest by removing any clothing. Then, kneel down at the patient's side. Place the heel of one hand on the lower half of the breastbone. Set the other hand on top and lock your fingers together. Please perform CPR according to the instructions.
Dad, are you okay? Can you hear me?
"119, what's your emergency?
My father collapsed. Please help.
What's the address?
State your address.
Is he conscious?
No, he isn't responding.
Is he breathing normally?
I don't think so.
Sounds like he's in cardiac arrest. Don't worry, an ambulance is on the way. Switch to speakerphone and start CPR, following instructions until help arrives. Place the phone on the ground next to you and do not hang up. I'll stay with you until the ambulance gets there. First, lay the patient on a flat surface. Clear the chest by removing any clothing. Then, kneel down at the patient's side. Place the heel of one hand on the lower half of the breastbone. Set the other hand on top and lock your fingers together. Please perform CPR according to the instructions.
Dad, are you okay? Can you hear me?
"119, what's your emergency?
My father collapsed. Please help.
What's the address?
State your address.
Is he conscious?
No, he isn't responding.
Is he breathing normally?
I don't think so.
Sounds like he's in cardiac arrest. Don't worry, an ambulance is on the way. Switch to speakerphone and start CPR, following instructions until help arrives. Place the phone on the ground next to you and do not hang up. I'll stay with you until the ambulance gets there. First, lay the patient on a flat surface. Clear the chest by removing any clothing. Then, kneel down at the patient's side. Place the heel of one hand on the lower half of the breastbone. Set the other hand on top and lock your fingers together. Please perform CPR according to the instructions.
When someone collapses right in front of you, it's easy to panic, especially if it's someone close to you. But here's what you need to keep in mind. Never lose precious time by calling a family member first. Call 119 right away. And never try to lift the patient or drive them to the hospital yourself. That could actually make their condition worse, even beyond recovery. When cardiac arrest happens, time is everything. Always call 119 first and tell them exactly what's happening and where. When someone is in cardiac arrest, your number one lifeline is 119. Make it the first call you make, always. CPR is one of the most important skills you can learn because this simple technique can save lives. Now, it's time to practice. The most important part of CPR is chest compressions. Don't worry, it isn't hard, so relax and follow along. Think of it this way. Your hands become the patient's heart, keeping blood flowing. You'll get the idea as you practice with your instructor. So, let's begin.
First, lay the patient flat on the ground and kneel beside their chest. Remove any clothing covering the chest. That helps you find the right spot for chest compressions and place the AED pads properly. Find the lower half of the breastbone and place the thick lower part of your palm just above the wrist line, right there. Then, put your other hand on top and interlock your fingers. Make sure only the heel of your hand touches the chest. Now line up your shoulders, elbows, and hands in one straight line. We'll now begin chest compressions. Press straight down about 5 centimeters into the chest, never deeper than 6 centimeters. After each push, release completely so the chest springs all the way back. Do this at a rate of 100 to 120 compressions per minute, counting out loud. 30 compressions at a time. Let's practice together. 30 compressions, 7 rounds.
One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
After the compressions, the patient will be in a more stable condition. Let's go over the steps again. Place the heel of one hand on the lower half of the breastbone. Place your other hand over it, fingers locked and raised so that only the heel of your hand touches the chest. Keep your arms straight and push down roughly 5 centimeters at a rate of 100 to 120 compressions per minute, 30 times in each cycle. So we've just gone through the most critical part of CPR. Not so hard, right? Now let's move on to the next step, rescue breathing, another essential part of CPR. The 2020 CPR guidelines say that even if you're not very familiar with CPR, you should still do chest compressions, even if you can't manage rescue breaths. If you're unsure, hesitant, or haven't practiced mouth-to-mouth, just focus on compressions. However, there are situations where rescue breaths really matter, like with children or someone rescued from drowning. So if you can do them, it can make all the difference. Let's see how it's done.
Put the palm of one hand on the patient's forehead with the second and third fingers of the other hand under the chin. Tilt the head back and lift the chin to keep the airway open. Be careful not to press on the neck with your hand or arm, as this can block the airway. Now you're ready to give breaths. With your hand on the forehead, pinch the patient's nose shut. Open your mouth and cover the patient's mouth completely, making sure no air escapes. Watch the patient's chest as you give a breath, 1 second in, then release, and repeat once more. Be careful not to overinflate. Each breath should be about the same as you would normally breathe.
Rescue breathing is about delivering oxygen to the blood. It's like breathing life back into the person. But don't forget, blowing too much air may lead to gastric inflation and trigger complications such as regurgitation. All it takes is a normal breath, just enough to lift the chest slightly. Do you know what this is? This is an automated external defibrillator, or AED. This device checks the heart rhythm and, when necessary, delivers a shock to get the heart beat again. With the CPR techniques you've learned, you can already more than double someone's chance of survival. Add an AED, and that chance increases up to 4 times. That's how powerful AED is in restoring the irregular heart rhythms that could eventually stop the heart. So when a person collapses, don't stop at just calling 119. Be sure someone brings an AED before you start CPR. Unfortunately, not many people actually use AEDs yet. So let's walk through how to use an AED, something anyone can operate with ease.
If you see someone collapse, gently tap both shoulders to see if they respond. And if there are other people around, try pointing directly and asking for help.
Hey, are you okay? Can you hear me? You in the black t-shirt with the backpack, call 119 immediately. You in the gray t-shirt, get an AED.
Tell one person to call 119 and another to bring an AED. Keep pressing on the chest until the AED arrives. Once it's there, have someone else take over CPR to avoid long pauses until the help arrives.
심폐소생술이 중단되는 시간을 최소화하기 위해 I brought the automated external defibrillator.
Do you know how to perform chest compressions?
Yes, I can.
Please keep performing chest compressions for me.
Open the cover of the portable automated external defibrillator and turn on the machine. Depending on the machine, some automatically turn on when the cover is opened. After turning on the power, follow the machine's voice instructions.
Attach the pad.
The machine's first voice instruction is to attach the pad. The location to attach it is marked. As shown in the diagram, attach one pad below the right clavicle and the other below the left nipple on the mid-axillary line. While attaching the pads, continue chest compressions if possible and follow the voice prompts.
Stand clear.
During rhythm analysis, everyone near the patient, including the person performing chest compressions, should step back and not touch the patient.
Analyzing heart rhythm.
If a shock is required, the AED will say so. Shock needed.
Shock needed. Charging.
While the device charges, keep up the chest compressions.
Stand clear. Press the flashing shock button.
Make sure no one is touching the patient, then press the button to deliver the shock. Resume chest compressions immediately. Since compressions tend to weaken after about 90 seconds, take turns every 2 minutes. This keeps CPR effective and allow the AED to analyze the rhythm.
Stand clear. Analyzing heart rhythm. No shock needed.
I'll take over chest compressions.
The AED checks the rhythm every 2 minutes, so continue compressions, taking turns as needed, and make sure the pads are in place. Don't stop until emergency crews arrive. Let's go over that again. Turn on the AED and place the pads on the chest. When the device is analyzing, stay clear of the patient. When prompted, press the shock button. After the shock, go right back to the chest compressions. Keep repeating CPR and defibrillation until the 119 team arrives.
Just follow the AED's instructions. It will guide you through every step. There are a few precautions you should keep in mind. When using an AED, make sure both the patient and the device are in a dry area. If the patient's chest is sweaty, wipe it off before placing the pads. And during analysis or shock, make sure everyone keeps clear of the patient. So where can you find an AED? In Korea, they are required by law in places like hospitals, ambulances, airplanes, trains, ships, in large housing complexes with more than 500 units, and in busy public areas. The idea is to make sure they are close at hand when someone needs help. That's why it's good to check where the AEDs are around you. You can look them up on the Ministry of Health and Welfare's website or mobile app.
또는 스마트폰 앱을 이용하면 주변에 비치된 자동 심장 충격기를 검색하고 위치 정보를 얻을 수 있습니다.
We've walked through the full CPR process. Now, with children, things are a little different. The sequence and method of pediatric cardiopulmonary resuscitation are the same as for adults, but there are some differences. The biggest difference is how deep you press. For children, use 1 or 2 hands and push down at least a third of the chest depth, about 4 or 5 centimeters.
그러니까 4에서 5cm의 깊이로 압박해야 합니다.
The rate is the same as with adults, 100 to 120 compressions per minute. And remember, since cardiac arrest in children usually follows breathing failure, it's vital to include rescue breaths.
심폐소생술을 하는 것이 중요합니다.
If you ever find a child in cardiac arrest, do not pick up the child and rush to the hospital before calling 119.
아이를 얻고 병원으로 달려가는 것입니다.
The lost time could put the child in irreversible danger. The right thing to do is call 119 right away, then perform CPR following the dispatcher's guidance.
전화 통화로 구급 상황 요원의 도움을 받으면서 즉시 심폐소생술을 해주세요.
Remember, always call 119 first and perform CPR.
하고 심폐소생술을 실시할 것 꼭 기억하세요.
Now, let's walk through how to perform CPR for children.
For infants and children between 1 and 8 years old, it is almost the same as for adults. The difference is just how hard you press. First, remove any clothing covering the child's chest. Place the heel of your hand on the lower half of the sternum and extend your arm vertically. Perform 30 chest compressions at a rate of 100 to 120 compressions per minute using one or both hands. It is crucial to note that because a child's chest is thinner than an adult's, compressions must be at least 1/3 of the chest's front to back thickness, meaning a depth of 4 to 5 centimeters. Open the airway then, pinch the nose closed. Breathe into the mouth twice, each breath lasting about a second. Be careful not to overinflate.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
We've now reviewed the process of cardiopulmonary resuscitation. There are 5 essential steps needed to help someone in cardiac arrest. These steps make up what's called the chain of survival.
심장정지가 발생한 사람의 생명을 구하기 위해 실행되어야 하는 가장 중요한 연결고리입니다.
When each part of the chain is done quickly and correctly, the chances of survival go up. Let's take a look at these steps. The first link of the chain is recognizing cardiac arrest and calling for help. The process begins when a witness who discovers the patient recognizes the occurrence of cardiac arrest and promptly requests emergency assistance. The second is performing CPR. Performing CPR on a cardiac arrest patient as soon as possible by a bystander. The third is restarting the heart with an AED. These first 3 steps are the ones you can take on the spot.
이 앞에 3단계가 심장정지 환자를 목격한 여러분이 해야 할 응급처치입니다.
The fourth link is life support provided by medical professionals at the hospital. And the fifth is post-cardiac arrest care and rehabilitation. This involves providing rehabilitation therapy for survivors at specialized medical institutions after the heartbeat of a cardiac arrest patient has been restored. For the best chances of survival, all 5 steps in the chain of survival must happen seamlessly.
For the best chances of survival, all 5 steps in the chain of survival must happen seamlessly. And how well each step works can depend on the systems in place, whether that's in a country, a local community, or medical facilities. The key factors outside the hospital that affect the survival rate include prevention efforts, CPR training, and a well-organized emergency response system. In fact, prevention is just as important as CPR. That means staying active, avoiding too much salt, drinking in moderation, quitting smoking, and managing stress. And don't ignore early warning signs, such as sudden chest pain, heart palpitations, difficulty breathing, or feeling unusually tired. If you notice any of these, seek medical help or call 119 immediately.
We've now gone over the chain of survival and the conditions needed to save a life. Still, some people might hesitate to give CPR due to concerns about infection, especially during outbreaks like COVID-19. But with simple precautions, you can still help safely. First, wear a medical-grade mask before giving CPR. And when checking for breathing or response, avoid leaning in too close to the patient's face. Before chest compressions, cover the patient's mouth and nose with a mask, towel, or cloth, and skip the mouth to mouth.
코와 입을 천이나 수건 등으로 덮고 감염 위험을 줄이기 위해 인공호흡은 시행하지 않고 가슴 압박만 시행합니다. 정기적
Use an AED if needed, but be mindful of hygiene.
감염 전파에 유의하면서 적극적으로 시행하고
When you're done, wash your hands thoroughly with soap or hand sanitizer and change clothes.
깨끗이 씻거나 손 소독제로 손을 소독하여야 하며 옷을 갈아입을 것을 권장합니다.
Also, follow up with local health authorities for guidance on testing or isolation.
자가격리 여부 등을 확인합니다.
So, that brings us to the end of our basic CPR training. Remember, don't doubt yourself or wait for someone else to act. You're ready. You've learned the skills. In a life or death moment, your courage could make all the difference.
5분의 기적, 당신도 그 주인공이 될 수 있습니다.